Hi, I am Dr. Kim Sage. I'm a licensed clinical psychologist. Welcome to my YouTube channel. I am so glad you're here. This is part of my Wildly Loved series where we're talking about within that series a mini series on what is my trauma type. And this is the last video around the main 6 types: attach, cry out for help. Please check out these other 5 videos on fight, flight, freeze, fawn, collapse, and submit. And then today's video, which is about the attach, cry for help response. Remember that all of these trauma types are basically what happens when, as a result of our childhood wounds or traumas or experiences in life, we get fixated or stuck in certain trauma go-to type responses. And so these are helping you hopefully identify what yours are and begin to build some kind of awareness and understanding about how to climb out and just do just a little bit of work in healing there. So while these videos are not therapy, I hope they give you information to further guide your education and knowledge and resources and reaching out for help if you need to. Please also quickly consider subscribing and clicking the bell, and that way you'll get notified when I post new videos. If you'd like to get this content daily, I am posting right now Monday through Friday, trying to commit to times, but just call it each day. You'll get a video hopefully, and I hope you will find it helpful. Also, please check out if you want more resources on the online courses I've created that are really just, as I keep saying, my heart's work, a year of work on helping those of us raised in really wounding childhood environments that have pretty significant attachment wounds. And so I have a course on remothering, a course on identifying, childhood issues that you may have experienced around emotional wounding, and my really flagship course on learning how to heal and deal with the trauma of being raised by borderline, narcissistic, and often called immature parents. But actually they end up falling oftentimes in those other categories. And it does make a difference because so much of that being raised by those kind of parents, it often ends up being internalized by you, that it is something wrong with you, because oftentimes they're not always bad. And that is the hardest part to understand. And so the courses are designed to help you heal your heart and your life and your relationships. Okay, the attach, cry for help. These last 2 I've talked about, collapse and submit, and attach, cry for help, you don't hear about as often, although they're becoming more and more common. Basically, I saw an article where the person talked about, when you have a family of kittens and the baby kitten gets separated from the mother and it just starts meow, meow, it just starts crying louder and louder and louder. Basically like, come find me, come save me, help, where are you? Or if we get lost somewhere, kids can do this, mom, screaming in like a box store or something. So basically it is this attempt for connection, this attempt to be saved and rescued. And what happens is, if you're a child where your attached cry for help was often neglected or often dismissed or sometimes responded to and sometimes not, you may find that what this feels like is this sort of desperate attempt to be saved and to be seen. Now, not in the way like, oh, that's so like, can't you help yourself? It can manifest in even, let's say, patients who have a hard time separating from a therapist, who have a hard time if the therapist is perceived as not being there for them enough. And in fact, it can be misperceived and called borderline in some people. That clinginess feels, if the person is not clear, the clinician, what they're doing, that need can be misperceived, and that clinginess. And so we want to make sure we're being really clear about diagnoses we're making and what is driving and the roots of these issues. And we know, of course, within borderline, there's a lot of issues around the label, which there are, but the core of it is emotional and relational dysregulation. And so a lot of that can look like that with this response. But basically what's happening is the person wants to be saved and seen. And so let's talk about kind of how that manifests and what it looks like in a person's life. Basically, it can look like neediness. And the neediness, let's say in a relationship, sometimes what happens is their neediness can be triggering to the partner. And so the more they lean in to get their needs met, the more the partner leans out. And that would certainly be true if you had a more anxious style and your partner was more avoidant. But what we're trying to do is to help people who get stuck in this trauma type is to learn how to get their needs met without it presenting as something that makes another person go, whoa, like that's way too much for me. And so what we're trying to do is help them regulate their bodies. We want to help them set boundaries. We want to give them the experience and therapy of what it feels like to be seen, because what's happening is they weren't seen and they were looking for you as the partner, as the therapist, to see them. And that is why it can be so important to work with the other part of the couple, is to help them learn how to also see the person so that the person can feel safely understood and seen. And this is why the issues around codependency, I think, are a problem, because this is an attachment wound and dynamic. And part of what helps heal that is learning to have that need met safely, not to be just, constantly, here's what you want and I'll give it to you all the time, but to have the experience for a person be that you are warm, you are safe, you are connected, and they can reach out and know that you'll be there. And so what's happening is they're often living in that highly charged, aroused sympathetic nervous state. And so we want to work on, if we're in that state, learning how to calm and soothe our bodies. I know I always say this one, but what's happening is it's like they're just constantly triggering into that space where there's that hypervigilance and that panic, and that doesn't feel good for them first and foremost, and it doesn't feel great for the relationship. And so if you had parents where basically, like I said, you didn't get your needs met, they didn't come crying when you were the kitten, or they sometimes came, but other times they left you on your own, you can see this combination, I think, here too, of a very disorganized attachment pattern. And that is why, like I said earlier, it can get confused with a borderline diagnosis. And this is what I think it looks like for many of us. If we've had this experience and we're not on the high end of disorganized, and we might be there too, but what it looks like is we can be very anxious in relationships and yet also be very, that fear of engulfment, which kind of goes with anxious, but also be very avoidant at times, right? It's like this push-pull, because we want so desperately to be seen and saved, and yet we've learned that human beings at the core are not trustworthy, are not safe, and cannot be relied upon. And so we can see a lot of sabotaging behavior that goes on here as well. So if this is your style, I hope you'll do more research on this category. Like I said, please check out the courses and the other links I'll link down below of others that I find helpful. And I hope you will stay safe and well. And the next few days, we're going to go into some positive qualities of the trauma types, and then the trauma type combos, the hybrid types we can see. And those will probably be kind of short, quick videos. But I just want to share more information also from, as I keep saying, this book, on Pete Walker's book, and also on client and patient experience. So thank you so much for watching. Please stay safe and well, and I will see you tomorrow. Bye, guys.